second. This is a repeat session of
The broadcast is now starting. All attendees are in listen-only mode.
Sorry, I had a little bit of an interruption. So this morning, I will be sharing with you the Virginia NICU Early Intervention Collaborative Change Package Implementation. This is a repeat session of Monday's webinar. Since that time, I did get updated data from the VHHA analytics team, and that is included in this presentation. Before we begin, I just want to point out a couple of things. This is a relatively small webinar, so please feel free to raise your hand. I'll be happy to open your phone line if you have any questions. Also, you can use the chat feature to alert me to a question or to make a comment. I did send out the updated presentation prior to this morning's webinar, but I want to point out that you can also download these slides, or the slides, as well as the attachments and exhibits that we'll be viewing during the presentation from the side panel on your GoToWebinar toolbar. Okay, I think I've covered all of the housekeeping, and again, welcome and thank you so much for joining today. So just to introduce the partners in the collaborative, the Virginia Hospital and Healthcare Association Center for Healthcare Excellence has been joined by the Infant and Toddler Connection of Virginia, as well as NewPath, a component of ARC, and NewPath is the support network for families in early intervention. I'm joined by my partners, Catherine Hancock from the Early Intervention Program, Tracey Edmond from NewPath, Abraham Segris, Betsy Cole-Archer, and myself, all representing the Center for Healthcare Excellence with the Virginia Hospital and Healthcare Association. So today's objectives are to review updates to the baseline data and targeted measures, provide you with an overview of the change package, and then present and discuss the change package implementation. Since the statewide meeting, we did get some information and feedback regarding the inclusion of premature, specifically the less than or equal to 30 weeks gestation. And so you will see in the upcoming slide, this is the main change to the baseline data, is the change of the premature to less than or equal to 28 weeks gestation in terms of what we're going to be tracking, or one of the components that we'll be tracking. And so this preterm category update, we had initially identified the group less than or equal to 30 weeks gestation as the targeted group for 100% referrals to early intervention. And the reason for that is that infants born before 30 weeks gestation have the poorest developmental prognosis of all infants. And, you know, so as we go forward, while we've adjusted the target to be consistent with the eligibility criteria noted in early interventions documents of the infant and toddlers manual, I want all clinicians and practitioners to be aware that that is not a limit, but we just want to make sure that we're capturing all infants. And so I have noted that on the referral guidance form, which I'll point out to you soon. But for the sake of consistency and minimizing any confusion, we returned that to the less than or equal to 28 weeks. So on the right hand of your screen, you'll see the updates, the preterm, less than or equal to 28, greater than 28 weeks. And then we separated low birth weight into its own category so that it would not confuse that breakout of the preterm. Now, the low birth weight infants typically, you know, are included in that less than or equal to 28 week grouping. So when we look at the data set, you'll see that low birth weight actually makes up the second most frequent number of occurrence of that diagnoses group. But there is overlap in the population. You can see that the occurrence of early intervention diagnoses, 24,000, approximately 500, and the total number of infants and toddlers that are represented is approximately 16,000. So we thought it would be just cleaner and easier from a data perspective to separate the low birth weight. So the highlighted rows in yellow reflect the change to the preterm data. So we're looking at preterm greater than 28 weeks gestation, and then preterm less than or equal to 28 weeks gestation. One other change to the categories is that we did roll in to the other category right here. We included the autism in that group because typically that's recognized at an older age, and that it was a very small number. I think there were only 18 cases in the state, and so we moved that up to other in order to present a more concise picture. So our baseline data findings really haven't changed. It's just the breakout or the segmenting of those categories is what changed. So we're still looking at these early intervention ICD-10 diagnoses representing approximately 17% of live births in Virginia, and that's for our base year of 2016, and that our Virginia hospitals in the collaborative represent approximately 70% of this population. The range in length of stay, again, 0 to 1,455, but you can see, you know, approximately half is discharged by day 4, and then you have a very, very long tail for the rest of that population. Here is a illustration of the length of stay, and again, you can see it's somewhat bimodal, with the majority, 54%, being discharged here by day 4. But we did group the 28 plus length of stay group, and that represents 1,853 infants. And keep in mind, as you're thinking about referrals to early intervention, that those infants with a length of stay of 28 days or more in the NICU should be referred to early intervention, regardless of their diagnosis or condition. Now we're looking at the preterm group. So this is the new breakout of the reflecting the less than or equal to 28 weeks. And you can see a bimodal picture here. The 28 plus, that's 541 infants with a 28-day length of stay or more. But you'll see here the 268 on the far left side. And my assumption is, while I haven't looked at all of those cases with the 0 length of stay, that those infants were transferred to another hospital at the time of birth for more intense NICU care. Preterm greater than 28 weeks gestation, just so you get a picture of this group. And you'll see that the majority here are discharged by day 4, but you still have a significant population, almost 1,000 infants represented in this group with a length of stay of greater than or equal to 28 days. So again, whether or not they're in that less than or equal to 28-week gestation, you need to consider other factors when making a referral to early intervention. Now, the toxic exposure is another segment of the ICD-10 codes that has been broken out because of the concern with addiction and getting treatment for infants that have been exposed. So the recommendation is that these cases be referred to early intervention. And here is a question that many of these infants do have a short length of stay, and it is a challenge for the NICUs as well as for early intervention, how to engage these parents and families with a short length of stay. And I'm sure that as we go forward with this work, we'll learn more techniques and hopefully identify some best practices. Moving on to the early intervention baseline data, you can see in this pie-shaped chart, hospitals represent 10% of the total referrals for 2016. But I just want to point out that pediatrician, family physician represented 45%. So when thinking about the hospital environment and the stressors of time of discharge for families, we need to think of the continuum when we're thinking about referrals, and bear in mind that some infants referred from the hospital may not really get connected to early intervention until they have that interaction with their pediatrician or family physician. And so that said, I do present both the pediatrician family practice data along with the hospital data on this slide because again, I think we need to think of these two healthcare providers along the continuum, and so both are presented here. So the over 50% are eligible for are eligible and go on to receive early intervention services, but there's a significant number of the population that are unable to be contacted, declined evaluation, contact lost, declined services, and so on. So we need to, as part of this work, target not only the quantity of referrals, but also the quality of referrals. And so you'll see on the left-hand side a description of the quantity, and this is what the hospitals will be tracking, and then the quality of referrals, and that is data that we'll be getting from the ITOTS data set. But first, we're going to look at the targeted improvements for the hospitals. And so this reflects both all hospitals in Virginia as well as hospitals in the collaborative. And you'll see that we start out with the large data set or the population from the early intervention ICD-10 codes. So for the state, we're looking at 16,048. From that number, we subtracted the number of discharges with ICD-10 preterm less than or equal to 28 weeks, and we subtracted the early intervention ICD-10 for effects of toxic exposure from this 1648. The net of that was multiplied by 50% because, again, thinking of this slide, 50% of population likely to be eligible for early intervention services are referred, and that's our target. So that's where the 6,609 number comes from. And then we add, to get our total, the preterm group and the infants with toxic exposure to come up with an estimated targeted early intervention referrals going forward of 9,439. For hospitals in the collaborative, we're looking at a total of 6,533 referrals. For hospitals, their self-reported data templates will be updated to reflect the change in gestational age for those that we are tracking and expecting the 100% referral rates. And then lastly, on the quantity of referrals, the reports that were provided to hospitals that provide a summary of the database as well as the improvements. Sorry about that, my mouse got hit. These reports will be updated and redistributed to the hospitals. Going on to the quality of referrals, so for the quality, we are looking at a 10% across the board improvement in the categories listed in the table. And again, this data will be provided by the Infant and Toddler Connection database. Are there any questions on the data before I move on to the summary of the statewide, regional meetings, and change package. Okay. So we had 5 regional meetings held during June, and one statewide meeting, which was held July 18th, and we had really excellent participation at all meetings and a high level of engagement and discussion regarding the recommendations and the change package. One thing that everybody agreed on was the collaborative aims. What we're working towards is to refer all eligible or likely to be eligible infants to early intervention, improve linkages to early intervention services for NICU patients and families, and then importantly integrate NUPATH as part of the NICU to early intervention care continuum. And just some high-level comments that we heard while we were out in the field and at these regional meetings and statewide meetings. And so you can see from the comments there's lots of opportunities not only for ongoing collaboration, but real improvements in the work and access to support and resources for not only the NICUs, but also the parents and families. So some themes that came out of the regional meetings and the state meeting are on this slide, and I think it's important to keep these in mind as we go through the change package detail. So first is to create consistencies across the Commonwealth, specific to the referral guidance and who is referred to early intervention. The referral process, we want it to be a process and not dependent on a single person. While there may be a person overseeing it and more involved, but we don't want a situation where when that individual goes on vacation for 2 weeks, no referrals are made. So it's important that it be a process. And also, it's important, I mentioned earlier about that connection in the continuum between the NICU and the pediatrician, specialty clinic, or family physician for continuity of care in terms of these developmental needs of the infants referred to early intervention. So it's important that the NICU act as a bridge to help facilitate the sharing of that referral information. We also came away with the change idea theme around reframing how early intervention and the services provided there and how what's provided in the NICU is perceived by the parents. And so this reframing has to do with communicating to parents and families that developmental skill building is a life skill and part of being empowered as a parent, and that it's something that you'll continue to use throughout every stage of your child's growth and development, and that coaching piece, emphasizing more what's happening in the NICU so that the parents are aware and familiar with that process. And so that reframing will be part of a paradigm shift, but I do feel it will help with the transition between the NICU setting and the home setting and support for early intervention. And then lastly, it's important that everybody be mindful of the fact that we need to accommodate the learning preferences of our targeted audience, which means that we need to be more illustrative. We need to have shorter clips, fewer words. And so as we go forward, it's something important to keep in mind. So our change package, what we hope to accomplish with it is this shift in paradigm, which is illustrated on your screen. So in brief, we're looking at early intervention, emphasizing the coaching and the developmental services starting as soon as the baby is born, really that being part of the parenting skills that are taught in the NICU, but really emphasizing those and helping the parent to see that transition in services. In the past, there have been gaps in support during transitions, and with New Path, really promoting that parent-to-parent support and being a resource during those transitions. When the project was started, we had no available data, or very, very limited available data from the hospitals on referrals to early intervention. We will be tracking early intervention referrals going forward. We're transitioning from thinking about developmental milestones along a linear path to really having more developmental sequencing, anticipatory guidance for families, and really encouraging and supporting families to thrive at the stage where they're at. And then lastly, clarifying the coaching model from that of medical care, and seeing the coaching model as a self-empowering and an important life skill for both the parent and the infant toddler as they grow and develop. So we did use driver diagrams to facilitate this work and to help us gain some clarity and focus on not only what our aims are, what we want to accomplish, but also to help identify those change ideas and the method that we'll be using for that. Now, this is the driver diagram for the refer all eligible or likely to be eligible and infants to early intervention. So if you remember our first aim, and so the primary driver here is reliable early detection. How would someone know who's going to get referred to early intervention or what those eligibility criteria are? So the group strongly supported use of what's termed the referral guidance form. And then with that, we are going to talk about hospitals adopting that process, and then some other information on increasing awareness. So I've pulled out from that driver diagram to put in this slide that content so it would be easier for you to read during the webinar. But it's the same information basically. So the change idea is to adopt and implement a guidance checklist, and for the NICUs to review the early intervention referral guidance form for all patients during weekly discharge planning rounds. That's a way to inform your colleagues of the referral and also provide information around what needs to be communicated to the parents and families, and to provide some structure for that. So you can see under the implementation side, we have the actual tasks, but also in the purple font is the responsible party. So I'll be providing education on use of the early intervention referral guidance form, and I will look for assistance from the early intervention system managers to assist with that. We also will ask the NICU leaders to incorporate the early intervention guidance into their discharge planning rounds protocol, and then we'll have an opportunity to get feedback at the second regional meeting, if not sooner. So this form, and I apologize for its poor quality here, but I did send you the actual hard copy, and it is available on the GoToWebinar toolbar. So you can download this. It's labeled Exhibit 1. But this is our referral guidance form, and this is what we're asking the NICUs to review during their discharge planning rounds. So you can see the diagnoses associated with developmental delays. Here we have gestational age less than or equal to 28 weeks. However, there is a notation there with an asterisk that all preterm infants are at risk for developmental delays, and encouraging the clinician or the team to consider all diagnoses and conditions listed, including other concerns specified. So what we don't want this to be limiting, and so you need to just be mindful and consider the full picture of the infant as they present. So this is what we would like used during the discharge planning rounds. You can see there is a field here for discuss with parent family on, and we're asking you to put a date there because that connection with the family is so important in building that relationship and giving them an opportunity to ask questions and learn more. Around reliable early detection, another change idea was the increased awareness of childhood development in hospital staff, parent, family, and community. And so through this work, there was an illustration developed, and it's entitled Supporting Skill Building for Parents. That should be parents, not patents, parents and infants on the NICU and pediatric hospital units. So we'd like this to be available so that you start creating that point of reference for the developmental skill continuum. And so that we're asking the NICU leader to be responsible for. And then we have the create a library of short video clips demonstrating developmental skill building across the continuum in the hospital, NICU setting, at home. And I will be searching the web for those short video clips and creating that library. What I'm showing on the screen now is the illustration that was mentioned on the previous slide, and this is what we would like to be posted on the in the staff, NICU staff area, the pediatric units, in the family lounges, so that they can, again, start to visualize and better understand developmental skill building and how it really continues. And there is some overlap between what's happening in the NICU and what will eventually happen at home. Are there any questions on driver diagram number 1 with the interventions that are recommended? I'm just going to give a moment here to see. Again, you can type in or you can raise your hand, and I would be happy to open the phone line. Okay. We're going to go on to driver diagram number 2, and that is around consistent referral process. As we visited the various hospitals and NICUs and gathered information from the needs assessment, there were very different processes going on. And not that I don't want to minimize the importance of the that there will be variation between hospitals, but we wanted to make sure that we had a consistent form to be used, and most importantly, that the documentation that was being sent with the referral, that all NICUs were aware of what was needed in order to minimize the gap and also to minimize any redundancy in assessment. So I think the requested information or requested documents is an important piece of this referral form process. So you'll see these items listed here, and I'm going to go on to the next slide. Here it's just a little bit larger and perhaps easier to read, but you'll see the responsible parties noted here: NICU leader, collaborative project lead around introducing the use of the referral form, and then talking about the using the referral form in discharge planning rounds as well. Now, item D, develop process for tracking referrals to early intervention. This is really a critical component of our work because we have those quantity performance improvement targets around ensuring that infants identified are referred to early intervention. So the NICU leader is assigned this as a responsibility, as the responsible party, but I will be following through with the NICU leaders and supporting them in that work. We did include in the referral, is the parent aware of the referral? So that, again, is important. And I know there are some times when it is not possible to meet with the parent. So it's key that no is checked off in that area, because it gives the early intervention team a heads up in terms of some additional support, some additional information, or just more background that may be needed for that particular family. But let's start at the top of the form here to share with you the steps that were identified for making a referral. So we're asking hospitals to use this form, and you'll see there's a link here that goes to your city county listing for all infant toddler connection of Virginia localities. And I'm going to go to the next slide just to share with you the form. So you would, based on the infant family's place of residence, identify the county or city as appropriate. And when you click on the link, you'll be brought to the central point of entry with the information, including the phone number, the fax number. This referral form will be faxed along with the documents to the number posted on this 211 central point of entry form. It also gives you the name of the intake contact so that you can speak directly to that individual prior to faxing if you would like to. But that's really, these steps are very important, and so having this link available to if it's a secretary who's faxing the document or administrative support person, they'll know where to send that, and it will save a step for not only the hospitals, but also for the early intervention team. Now, if you're making this referral and you do not have internet access and you cannot use the link, you can always call the statewide central directory, and that number is provided here. So we're asking that this form and the requested documents are faxed to the number on the 211 form, but that you also fax it to the pediatrician or primary care physician identified at the time of discharge. For that continuity of care, it's important that the pediatrician be aware that a referral has been made. Also, it's important because if the parent has not followed through with the referral, if there was a gap in when they were contacted by early intervention, sorry about this, it's important that the pediatrician be aware so they can encourage that, and rather than take the wait and see approach, that they, as I mentioned, encourage that referral or make another referral for that individual and family to early intervention. And lastly, as part of the referral, in addition to providing the infant and toddler early intervention brochure, we want the hospitals to make sure that the family or parent has the link to the New Path website. It may be helpful prior to discharge just opening the New Path website so that the parent and family can see the information, the support that's available on that site. Now, you've probably been distracted by this big yellow box on the right-hand side. If you look down to the lower middle portion of the referral form, you'll see that I have a list of the documents that are requested at the time of referral. So we're asking for the discharge summary, the completed early intervention referral guidance form, the any NICU therapy assessments, and then the developmental skill building worksheet, which I'll share with you in a couple of slides, and then the signed consent release to release protected health information. And what information we have received is that hospitals are asked to seek input from legal counsel on amending their NICU consent form so that it references the infant and toddler connection of Virginia early intervention. And if they do that, then they wouldn't need to get the signed consent form. However, if their maternal child consent is not, does not include that, you would need to get counsel from your legal group, and or alternatively complete the consent form that's provided on the ITC VA website, which I have a copy of on this slide, the next slide. But before I go on, are there any questions on the referral form or its use? Okay. Again, this is from the link. We saw these slides earlier. And then this is the release that is provided on the ITCVA website. I did get some feedback from hospitals and physical therapists who make referrals to early intervention, and they were concerned that their hospital legal counsel works very slowly. And so they may not have a prompt response, and they also, it may take a while to adjust the consent form if that's the course that's decided. So in the interim, we encourage you to use the form, and there's no reason not to, or this work does not preclude getting this form signed as well if you would like to. We just are trying to streamline the process and also, make it clear in terms of what's needed and what's not. What the question is it sufficient for the release to name the Infant and Toddler Connection of Virginia, which is not a legal entity? Well, that is a good question. It is what is on, this is printed from your website. This is not a form that I changed. So I will follow up with Catherine Hancock and ask her the information. Thank you for the question. Because we do use the infant and toddler in a couple of other places. So I'll follow up with Catherine on that. So a couple more points regarding consistency in the referral process. First, throughout the time period of the project, the infant and toddlers central 211 referral line the link has not worked. And so it's really critical that the Infant and Toddler Connection of Virginia develop regular quality checks on its website to ensure that the referral link is working. It's discouraging for the hospitals to go through the work and have a referral and have the link not work and kind of be stuck with wanting to make the referral but limited by the dysfunction of the link. And the other piece of feedback we did hear was that information on the Infant and Toddler Connections website is it's very difficult to find information and to go to what you need without having to go through either multiple layers where something may be hidden, or perhaps there's a different term used. So I think working on that usability of the website is encouraged for achieving our targeted outcomes. Just going to check if there is any other questions. Another question. The local system name is not a legal entity either. The program or agency name is often different. I know that sometimes there is the region, so it'll say Shenandoah Valley or Infant and Toddler Connection of Shenandoah Valley. So again, I will follow up with Catherine on that, and before I end the webinar, I will take a screenshot of those questions so that I can pass those along. So moving on to driver diagram number 3. This has to do with improving linkages to early intervention services for NICU patients and families. And so this is really a key component of the work, because you can make referrals, but if those referrals are not followed through upon, then it's a lost effort. And so it's important that we look at these change ideas and the implementation and ensure that we are working effectively to engage the parent and families in this work. So our change ideas are highlighted on the next screen. So I'm going to move on to that. So we have each hospital to identify its continuum for parents referred to early intervention, with emphasis on support and resources available during transitions in care, and to be sure to identify NewPath as a support. So I will be working with the hospitals to define their continuum of care for NICU parents and families, and we'll also engage early intervention in that work. Since the community piece, it's important that the family that the NICUs and we're all on the same page with how things are being described. We want to make available to the parents the listing of resources available, including the NewPath website link and early intervention contact information. There's some wonderful early intervention videos that we will be asking NICUs to post on their NICU channel, as well as including these videos and the NICU, the NewPath link on the iPads that are preloaded and used to inform parents and families. And so that would be a good opportunity for the parent and family to learn more and have a point of reference for the work, the important work that's done by both of those organizations. Many hospitals, if not all, were unfamiliar with NewPath when we were at our regional meetings. And so a recommendation is to invite NewPath to present at NICU staff meetings, physician rounds, again, to familiarize staff with the role of the parent-to-parent support and the importance of that parent-to-parent support, and also talk about the importance of those developmental skill building, not only in the NICU, but also once discharged in the community. So many parents and sometimes the NICUs or the people referring would get discouraged because they really didn't know much about the referral process and either the time it took or the steps that were needed. And an early intervention system manager shared with me an algorithm that was created to help explain the process. And I'm going to show it to you on the next screen. It's very clear, but I think we need something a little warmer and a little easier for the parent and family to gather that information around next steps. So we're asking that early intervention create a short video explaining how the referral to early intervention is managed and what the parent and family can expect. And also we want to have included in that video the parent-to-parent support that's available during that interim period, especially before they get hooked into or have had contact with the early intervention case manager. So this is an illustration of the algorithm that is used to explain the referral process and how eligibility is determined and how the service plan is created. So this is what we would like to have made into a short video clip, maybe like a 3-minute video clip. And so I have spoken with Catherine Hancock on this topic, and yeah, she definitely is on board with that. Now, another issue that comes up during the referral process and thinking about the quality of referrals and how to ensure that referrals are processed and that the family members become engaged and agree to services when appropriate, we need to help identify those parents and families who are at risk for declining early intervention assessment or who become lost post-discharge. So this is a broad-ranging change idea, and many components of the care that's delivered and the relationships and the interactions that happen on the NICU may influence this outcome. But as a starting point, what we'd like to do is to provide some education on how to identify those parents who are at risk for follow-up with discharge plans. And so that will be a collaborative effort, including the NICU leaders, myself, NewPath, and the early intervention system manager. So we will be having a work group looking at how to provide that kind of support and guidance. Once we do the education then, or develop the educational pieces, we will be asking NICUs to develop a protocol to assist parent-family identification in terms of those at risk and help the parent-family identify available support, either doing a pre-discharge phone call with your early intervention case manager, or perhaps a visit from the early intervention case manager, and sharing the NewPath link and maybe showing the parent or family the NewPath website so they can see. It's a very gentle site, and I think it's a very warm site, and you know, it may be appealing to a parent who is feeling somewhat stressed and unsure of next steps. Going on to some additional change ideas related to the reliable confirmation of parent-family engagement. We heard some best practices that NICUs, about NICUs using a reward system for families. And some things we heard were dollars, NICU dollars for using in their NICU gift shop, bonus beads, Dine and Discover. You know, there's a lot of opportunity to encourage, support, and reward parent and family engagement in specified learning or identified areas. And then also, we want to promote parent-family engagement with the NICU team through use of On Our Way, which is a family-centered developmental skill building worksheet. And we're going to go through that in just a moment. And one thing I want to point out is we, following our webinar on Monday and just getting some additional feedback, we're changing the name of On Our Way to On Your Way. And you'll see in the next couple of slides how that came about. So moving on to Work Plan 4, we're looking at differentiating early intervention coaching services from that of the medical model. And here we're looking at emphasizing educating NICU staff, hospital staff, really the individuals on the healthcare continuum on what the coaching model looks like, but also helping to recognize the coaching that goes on in the NICU. There's a lot of parent family engagement and education that goes on in the NICU, but helping to identify it as a coaching and also emphasizing those family developmental skills is an important part of this change process and the change ideas that will be shared shortly. We also want resources and materials that reflect the cultures and languages of the population served. And so we will be going forward in the longer term just making recommendations on those suggestions. I do have available to all hospitals the developmental skill sheets that were provided by the University of Virginia, which go through the gestational, or they're organized by gestational age, the developmental skill building and sharing of that information from the infant's perspective to the parent. I have had those translated into Spanish so that hospitals can use those, and I will send those out and make those available. And then around the New Path support of this change idea is to include the New Path website link on discharge forms and other materials, and then also incorporate this information in conversations with parents and, sharing the link with parents so that, they're aware, and also have the link to the infant and toddler websites available. So here we just have highlighted those change ideas that I covered. So introducing and implement the use of On Your Way, and that early intervention, integrate reference to it should be On Your Way in their materials, and then to evaluate, we'll get some feedback on this process. So this slide shows you the developmental skill building worksheets that were developed for NICU nurses to use with parents and family members, and that the On Your Way mirrors this somewhat in terms of its concept. But these worksheets, the one that's on your screen now, is developed by the University of Virginia's NICU Parent Advisory Council, and they graciously allowed us to share them for the collaborative. And so I have sent these out in the past, but I'll send them out again because I do think they're just a nice resource and something nice for parents to read while their infant is in the NICU, or even when they go home. They're organized by age, so this one is less than 26 weeks gestation, but they're several worksheets. There's, I think, 4 or 5, and they go through all the way to 36 to 40 weeks gestation. So we're going to move on to the On Your Way, and this is really, initially I had called this Family-Centered Developmental Skills worksheet On Your Way, On Our Way, but after getting input and working with Kelly Hill on these, I think On Your Way is a much more appropriate name. But as you'll read about the NICU and the importance of managing the environment, that it's a scary place, but getting to know your baby and learning these family-centered developmental skills will get you on your way. And so just some thoughts before we look at the actual worksheets. The content is fairly general, and it's based on universal practice, but NICUs provide different services, and so and have different staff and different expertise, and so it's important that the NICUs adapt On Your Way to fit your milieu. We want these to be usable for your team as a way to integrate what's happening in the therapy with what's happening at the bedside or isolate side, and also for alignment in messaging with the parent and family. There are a million scenarios that could be portrayed and no way to cover them all. We tried to keep this somewhat brief, and this is a draft format. And these worksheets are intended to be individualized to reflect family-centered care. I did send this out. This is a lot of words. It gives a description of how this program works and the thinking behind it. We will be, tightening this, putting in some illustrations and pictures so that it will be fun for the NICU team, as well as engaging and fun and a feel-good piece for the parent and family. So this is the overview of the family-centered skills. And so you'll see we always start with, how is my baby feeling today? And so here we encourage the parent or family to take the first minute or two to observe their baby and then to check off what's observed. And again, these observations can be, things can be added here, but we just wanted to provide some guidelines for what the parent can look at and how they can read these cues that the baby is providing through their behaviors. So an excellent suggestion from Kelly was to take a video or encourage the parents to take a video, which is in the observation tips, and then to watch it a few minutes later to really enhance your observation skills, because as a parent, that's one of the most important skills you can learn, regardless of the age of your infant, toddler, even for teenagers. It's good to be able to observe your child and understand what they're trying to tell you, and also to decide upon the best method or technique for intervening or supporting or calming. We want the family to share the video with their NICU team to reinforce the observations, and then also use it to inform your team, and then decide on a plan for the day with guidance from the NICU team, whether it's the nurse or the therapist. Now, from Monday's webinar, what has been added to the worksheet is cluster care. So you'll see we have smelling, sleeping. Now we have cluster care included: listening, touching, positioning, feeding, and looking. And so these family-centered skills, using this worksheet, we ask the NICU therapist and NICU nurse to instruct the family member or parent on some methods and techniques to use. And you'll see there's a description here of the smell rag and something to use. And then as the parent and family practices those methods or techniques, and there could be several for sleeping, or clearly there will be several for cluster care around changing a diaper, taking a temperature, and so on. But as they become proficient in those areas, they'll sign off, and then with the team member, and maybe have a sticker or some kind of recognition of that accomplishment. And that'll provide a good point of reference for the parent and family when they're discharged, in case they need to look back and use one of these methods or techniques going forward, because these methods and techniques will become part of the parent's skill set as they bond, parent, and grow with their infant. Following the sheet, the initial sheet, we have some descriptions of these family-centered developmental skills. And again, this is in a draft form. I think I need to tighten this and probably have fewer words, but would like input from the collaborative on that process. And again, by NICU level, there may be some variation needed in this information. So we describe each of those family-centered developmental skills. And our intention is that these worksheets will really help to empower the parent and help him or her feel more confident in terms of their observations. So every day, so now you have your introductory worksheet where you kind of go through learning and understanding of the different family-centered skills, but then on a daily basis, you'll come in and do your observation. And so every day the parent, or when they visit, will have a new worksheet. And the first thing you're going to do with the worksheet is determine how your baby's feeling today. And it's the same steps, the same process. We want you to take a video with your phone, watch it a few minutes later, and really refine those refine your skill in reading your baby's cues. And so sharing the video with your NICU team provides an opportunity for coaching, for reinforcement of the observations, and then determining together what's the best plan for the day. And, you know, it takes a team, and so I think encouraging the parent to engage the NICU team in this work is really important to helping them feel supported in the care of their infant, and while at the same time building their competencies. Are there any questions on the on our way, or will be newly labeled soon, on your way worksheets? Okay, don't see any questions here. Okay, we'll go on. Driver diagram 5 is around educating NICU parents and families about developmental milestones and early intervention. And these change ideas are reflected in the developmental skill building worksheets, the On Your Way worksheets that we just reviewed. So I'm not going to review these again, but I just want to make the NICUs, the early intervention, and those involved in the collaborative, that the developmental skill building worksheets are multi-purpose and will definitely help educate families about the developmental sequencing. They'll learn about early intervention through that, and it will be, I think, an engaging tool to use in each of those settings, and by using the same process or language or coaching will help reinforce our skill building continuum. And I think it will encourage the parent and family then to understand more about the importance of that early intervention referral, which is ultimately our aim in this project, is to have, you know, ensure that all infants in need of early intervention are referred, and that there is, you know, follow through on that referral. So here I just summarize what the near-term priorities are for both the hospitals and the Infant and Toddler Connection of Virginia early intervention. That's a mouthful, but what the priorities are going forward in the near term. So for the hospitals, implementing the early intervention referral guidance form, implementing the early intervention referral form, develop a process to track early intervention referrals, promote supporting skill building for parents and infants. And that's that illustration. So we want it to be, you know, in your staff lounge area, where parents may, you know, have an education class, or where you may have a parent-family lounge, but again, helping to raise awareness. We would like the NICUs and early intervention as well to provide feedback on the On Your Way family-centered developmental worksheets, and then for the hospitals to invite NewPath to present at a staff meeting or physician rounds. For infant and toddler, we want to have a process in place to ensure that the website links are working, improve the user experience on your website, create a short video of referral process algorithm, which was Exhibit 4, to include NewPath name and link on your materials with a tagline, the support network for families in early intervention, because on its own, NewPath people won't understand the importance of NewPath. And so including that tagline is a critical step. And then lastly, to work with hospitals on interventions for parents and families at risk for not following up with referral. So on a high level, it doesn't look so bad, not quite so daunting. On the long term, here are some of our priorities. For the hospitals, track and report referrals on the Virginia Hospitals data sharing site, and this is under construction. This will be a SharePoint site, so I'm hoping that it will be available soon. And once we get that SharePoint site working, we can not only have hospitals submitting their data, we can also post the documents and materials and forms that have been created through this work. We, in the long term, would like the hospitals to implement the On Your Way family-centered developmental worksheets, to utilize a library of short videos to help inform parents and families, as well as staff, and then to regularly meet with your early intervention system managers and NewPath regarding referrals and parent-family engagement, because it's that relationship building, and the stronger the relationship and connections can be between the hospital, early intervention, and NewPath, modeling that behavior will carry over into how parents and families perceive the continuum. So that's really an important piece. Moving on to the left side or the right side of our screen for the infant and toddler connections long-term priorities, we have, again, just ensuring the website links are working, to contribute to the video library of short clips, and then continuing to work with hospitals on interventions for those parents and families at risk for not following up with referrals, because being out in the field, I think that early intervention will have some key points, best practices, additional information that may help and improve those outcomes for those parents. And then lastly, number 4 is to regularly meet with the same as with the hospitals, that relationship building between the hospital's early intervention system managers and NewPath. So that is the change package. I'm going to just open my toolbox here and see if there are any questions or comments in chat, and I do not see any. So I'll just wait a moment. Okay. We'll go on. So just providing a schedule overview for what's coming up. Following these change implementation webinars, I will be scheduling a meeting, webinar, or phone call, and/or maybe all three, to get more feedback on the On Your Way developmental worksheets. I will begin implementing the near-term priorities that were identified in that one slide. We're going to start doing that August 17th, and I will be setting up site visits to NICUs as well as arranging coaching calls to support that work. We will be having regional meetings in November to look back and see how we're doing, and look ahead and see what we need to change. And then lastly, we have our Sustainability and Spread webinar on January 24th. Here is an overview of our upcoming regional meetings in November. I will send out a link to a survey so you can select the date that works for you, and I will then follow up with calendar appointments so you can put those in your, have those saved. And lastly, participating hospitals will receive an updated data package. And then if you have questions regarding the early intervention ICD-10 database, please contact David Beaumond and his email is there, or you can always contact me and I will either assist you if I'm able or refer you to David. And with that, that is the end of the presentation. So I'm going to just check again to see if there's any comments or questions. Okay, I don't. Just going to open here and see. Okay. I think we are, if no one has questions, I'm going to go ahead and end today's webinar. And I would like to thank you very much for your time. I see that Kelly is on the line and just want to recognize Kelly for her assistance with the On Your Way developmental worksheets. She's been a great assistance and will be helping me going forward with not only refining those, but also helping to provide education at the NICUs on the suggestions for how to use the worksheets. But we will be engaging the NICUs and getting feedback and also from early intervention. If you have feedback on the worksheets or recommendations, we would welcome those as well. Okay, well, I'm going to go ahead and end today's webinar, and thank you so much for your time, and I look forward to continuing to work with you on this project.